everyone. My name is Kathy Basher, and I've got Lori Vergeer here. I want to welcome everyone on behalf of NAMI Yavapai, Northern Arizona Family Coalition. Today, our topic is Finding Help Families' Mental Health Quests. Many families struggle to find help and navigate the mental health system when their loved ones are diagnosed with a mental illness. Join us this month for a discussion featuring 3 family members who will talk about their journey and what worked and what didn't work for them during this journey. And so the first speaker that I would like to introduce is a NAMI Yavapai board member, Mary Beth Myers. And she is the author of The Still Hours of the Night. And there Candy is duly holding up her little book, which we've all enjoyed and really given some wonderful insight into mental illness and the journey of the family member. Mary Beth found herself in the midst of navigating the mental health system beginning in 2016, culminating in the eventual diagnosis of bipolar disorder in her 38-year-old son, Paul, in 2019. Mary Beth is a senior associate at Bank Vision Incorporated, a risk and consulting firm for financial institutions. So she's the secretary of the NAMI Yavapai Board of Directors. So thank you, Mary Beth.
Okay, good morning, everybody. It's my pleasure to be here and to share my story with you this morning. As Kathy mentioned in her introduction, my story began in 2016 when on a visit to Portland, where Paul was living at the time. And at the time he was 37 years old, you know, being a struggling artist, but he was up to that point very self-sufficient. You know, he was able, even though his artwork wasn't selling, you know, he's an artist, so, but he was able to take care of himself. But that visit to him in that August of 2016, my husband and I, Jim, we noticed that there was just something off. He was just acting a little strange. And over the weekend, you know, we just noticed more and more bizarre behavior, not to the point where he seemed to be, I mean, he could hold a conversation with us and everything, but he would just do different things that was just not typical of him. So anyway, we left that weekend thinking, okay, something that was weird. What was it? My family have, at the time, I didn't believe it, but we didn't have any experience at all with mental illness. So that was the furthest thing from my mind. I was thinking he was just maybe, you know, he was always into artificial intelligence and sci-fi, and, you know, he's a highly intelligent young man. So I kind of just chalked it up to him just being a little eccentric and, you know, but still wondering what in the world was going on. So for the next few months, phone calls seemed, you know, normal. You know, he'd call, I'd call him. We talk about his work, and, you know, everything seemed to be okay. But then in the fall, I got word through the grapevine that he did some really bizarre behavior. So that started to concern me. He then at that time left his apartment. He started living in his car. And of course, now I'm thinking, okay, what's going on? So this is when the Googling starts. What is, you know what you do, WebMD, you know, these are the symptoms. What is he doing? He, for the next several months, was living in his Jeep. I was trying to convince him to come live with us in Arizona, you know, to regroup. I thought if he got into a stable environment, he could get a job, save some money, get back on his feet. In fact, everybody thought that. So he came to live with us the following summer, and I call it the summer from hell because it was. It was at that point that during that period when he was living with us that I started noticing him what looked like hallucinations. He would sit on our patio and act like he was conversing with somebody. He wasn't talking out loud, but he was acknowledging things around him. I confronted him about that, and he immediately denied that anything like that was going on. But that's when I started focusing on mental illness, and something is just not right. He towards the end of the summer, left our house, and again took off. He had some money, through helping my father with some work and stuff, but he took off on the road again with his cat, living in his car, going from city to city, eventually ending up in Virginia. And during that time was when he completely cut us out of his life. He accused us of stalking him, hiring people to stalk him. And the only way I knew where he was is he would keep in contact with his biological father through text messages. So I found out where he was at. With that, then I started thinking, okay, now what do I do? He's completely cut us out of our lives. He hates us. And I went to a counselor thinking, okay, well, trying to get information from them, their opinion. This is what he's doing. What do you think is the problem? And of course, without talking to him, they wouldn't diagnose anything. But my suspicions, because I did catch him with the hallucination, acknowledgement, I immediately thought schizophrenia. So anyway, fast forward, while he was in Virginia, there were some events there that he ended up in the hospital, psychiatric hospital. And that was my thank God moment. He's going to get better and come back to us. Well, he was released after 2 weeks and still in the same frame of mind with us. He hated us, didn't want to have anything to do with us. He was on the road a little bit, but and it was during that time that I thought, okay, my hopes of him getting help in the hospital were gone. It didn't work. I was resigning myself to the fact that I may never see him again, and basically was kind of grieving the loss of my son. I tried to reach out to psychiatrists to figure out how to deal with that, and it was just really bizarre. I would never get an answer from any kind. I'd contact a psychiatrist's office to make an appointment, would never get any help back. So it was during this time that I started Googling again, not started, I mean, that's all I did constantly. And I came upon a NAMI site in Prescott. And I thought, well, what's this? So I contacted them, and I can't remember his name at the time, but I believe he was the NAMI president, Yavapai president at that time. But he said that there was a support group that met, and at that time, the participation wasn't real high. So they were combining both peer and family support groups into one. But this was he goes, and we're having our next meeting on Thursday. And I was just so excited. I thought, here I go. I'm going to get some answers. Showed up at the NAMI group meeting on that Thursday. I was a little early and nobody showed up. There was one other gentleman that came, and he was a peer, and we sat there and talked for a few minutes. He was talking about bipolar disorder and how he needed to get back into the group and blah, blah, blah. But he left. I sat there for a few more minutes, just hoping somebody would show up. Nobody did. So again, I was dejected. My thought that I was going to get some answers was gone. So I immediately then the next day called the president, and I said, okay, nobody showed up. And he apologized profusely and said, that's kind of how it's been for a while. But he said, but we have a family to family class starting up in another week or two, and maybe that's something that you should do. So he gave me I believe it was Kathy's information. I reached out to Kathy and said, I want to get into this group. And that is how I found out about NAMI. Going through that class, it was early on when I was taking that class that Paul did come back to us. I call it come back to us because I think what happened was the medication that he did receive when he was in the hospital finally kicked in to the point where he realized that we weren't the bad people. So he did come back to us. We still had a struggle that year, but I went through the family to family class, learned an awful lot about mental illness, learned that it definitely, knowing the whole realm of mental illness, knowing that it is in my family, just from, I've got a sister with depression, and she's got compulsive I mean, it's just, I look at different things that have happened in my family in the past. I'm going, well, yeah, that person could definitely have bipolar disorder, you know? So I don't diagnose anybody, but it helped me so much to the point where I learned not only how to, mainly how to talk to Paul. The good news is towards the end of 2019, after I'd gone through the class, Paul was living in Prescott, or no, he wasn't, I'm sorry, he was in Holbrook. He was hospitalized again. And it was that hospitalization that he was forced to take medication. It was a court order. And once he was on it and stabilized, he realized that, yeah, this is what I needed. Paul today is doing really, really well. I mean, I've just been very blessed with him realizing that the medication helps him, that he's able to hold down a job. It's part-time, but he's working, he has a girlfriend, and he's just a very happy person. He's, you know, you know, again, I don't want to say that he's back, but I feel like I have my son back.
Thank you so much, Mary Beth. Paul wrote a book about his journey through bipolar diagnosis, and Mary Beth wrote the companion book, The Still Hours of the Night. So you can read both and you can see both sides of what Mary Beth was going through, why Paul was going through his journey as well. And our next speaker is Carol Lewis, and as a retiree of Yavapai County, I feel a kinship to her. She is currently the Assistant Director of the community, Yavapai County Community Health Services, and she's worked for the health services for 32 years, much better pension than I have. But she's married to Michael, a special education teacher, and has two sons, Josh and Mikey, and two grandchildren. As a mom to a son living with bipolar, she is committed to sharing Mikey's story, and that's how we got her, because we had heard that she'd shared her story, to bring more awareness and support for parents and caregivers living with social, emotional, and behavioral changes in children and youth. And welcome, Carol.
Well, thank you for that introduction. I'm going to go ahead and share my screen. Okay, so I'll go ahead and get started. You know, putting on my professional hat, but mainly this is my mom's hat coming on right now. I'm going to show you Mikey's story. So Mikey was born August 18th, 2008, 8 pounds, 8 ounces at 8 a.m. in the morning. Some of the challenges of being a parent with a child with mental health issues, I don't have to tell a lot of you this, but it's the lack of available support groups for parents with child and youth living with mental health. The stigma. I have a coworker that told me there's a stigma attached to mental health issues. I see it more with older generations who believe mental illness is a mindset, and our children just need to suck it up. The lack of understanding and compassion for what our youth are going through, especially since the pandemic hit. The lack of licensed child psychiatrists to test, assess children, youth. A single parent that I work with said not being able to focus as much time on youth mental health as I would need to in order to help him. And the not my child. You do not think it will be your child. You do everything you have to have a healthy and safe pregnancy, childhood, and home, but there's no control. As parents, we are challenged every day, but also realize there's a chance for our patience and growth. I'm going to show you pictures because I think pictures don't really show what's happening, but they do show what's happening when it's going on. So like I said, Mikey was born August 18th. He's going to be 14 this year in August. At a very early age, it's interesting from our previous speaker, he loves art. He was drawing on his Echo sketch, very detailed art, by the time he was 18 months. And he was reading books by the time he was 3. The puzzles, what you see as a kid that loves puzzles, all those puzzles on the wall. And then you see him being in front of a mascot. Well, pictures don't show you. And also the top right is where he was admitted to at 5 years of age to Phoenix Children's for Kawasaki disease. So what the pictures don't show you is his obsession with some of these things that started at a very early age. If the puzzle didn't turn out the way he wanted to, or he was missing one piece, things would be flying everywhere. He would have to check out every book on sharks one week, or every book on something else the next week. His fear of mass increased after his stay at Phoenix Children's Hospital, where this was at 6th grade. He finally was able to face Binky, the mascot there. My husband taught at the same school he attended from K through 6th grade, which was a lifesaver. My husband is a special needs teacher. But until that time right there, he would run out of the building, literally run out of the classroom frantic to see a mascot. And then the bottom right, it was right before the pandemic and Disneyland closed. We did go to a trip and he was able to move forward and not run when he saw a mascot. I mean, that just happened like 2 years ago. So these are the things that as a parent, you know, I raised, my oldest son is 31. I raised a child, so I knew the signs to look for. But my husband and I both saw some of these signs were not the most common things that kids go through, especially at a young age. The next one is about seeking a diagnosis and treatment. Mikey was diagnosed at age 10. He testing by a psychiatrist diagnosed him with bipolar. In the 3 years, we have seen 4 psychiatrists. We had an appointment in December to see the 4th psychiatrist, but that was canceled. So it's a struggle trying to get in, like was said, with treatment. We met with Dr. Gregory at Ponderosa Pediatrics last week, and it's been a lifesaver. She took a DNA test to check which medications are going to work best for Mikey. We've gone through so many with him. We know lithium doesn't work. We know which ones don't work, but we never knew which ones do work. So we're thankful for that. During an emergency visit at the hospital, we connected with Teros, a mobile crisis unit. Since then, we have utilized Teros in our home during a crisis. We're fortunate that Mikey does see a counselor weekly, Mr. Bill Winterholm, as Mikey, he calls him as Mr. Bill, has been a consistent present in Mikey's counseling journey. Trying to get, like I said, psychiatric care, treatment here. We've been turned away from facilities that say you're not on access, so we can't help you. So, you know, and I understand there's a need for access, eligible people to go there, but if you don't qualify for access, we were turned away. Luckily, Charles will come to you no matter if you have insurance or not. School support. Mikey currently attends Bradshaw Mountain Middle School. The whole administration there has been a godsend for us. The principal there really supports their students. They're into an instructional strategy where teachers can accommodate to help kids who struggle emotionally or academically. Teachers provide the notes. Note taking in classroom will set my son. The interesting thing is my son does not show behavior issues at school. He shuts down, does not participate, he's the quietest. Like, teachers love him because there's no outburst or anything. The thing is he saves those outbursts for home. At the end of the day, when he comes home, we're the targets. So whatever happened that day that upset him, he doesn't vocalize it. He internalizes it, and then he sets it out on us. And what so that's one of the things we're fortunate. He's really into music. He plays the cello, he plays the guitar, he recently got a drum set, he plays the saxophone, he plays the piano. The school district, the school support has been amazing. The school was able to apply for a grant through the Arizona Department of Education to fund Trisha's position, who's a social worker there. So the grant provides a licensed mental health worker or social worker at all the campuses. If a student needs additional resources, the school referred to a behavioral health agency, so it's the Southwest Behavior, and a student can receive services for free. If the school is in need of assistance with a student in a crisis, they call Teros. So Mikey and Trisha take a lot of walks around. When he's feeling frustrated, he does go. Rather than the outburst in the classroom, he will go to an adult. He'll go to Trisha or the principal and say, hey, I can't do this right now. And that's when they kind of help him with that. Just the things that's what's needed in rural areas is a collaboration among healthcare systems, schools, primary care physicians, and family support programs that challenges faced by our children and youth living in rural areas. The reducing the stigma of mental illness and behavior disorders among children and youth, and most specifically, mental health services for children and youth in rural areas that I said are both open to private and access patients, and provide more inpatient services for children and youth. That's a challenge to try to find any inpatient services. That's the end of my slide. So I try to keep it short. Since Mikey is in 8th grade, last week, everything happened last week. We saw his new psychiatrist, and he also was approved for an IEP. So because, they're saying because of the pandemic, everybody's academics are really low at this time. But because he was tested, he scored really high, he scored low for academics, but he scored really high for depression. So we are starting an IEP that hopefully will help him succeed as he goes through school. So other than that, and that's one of the quotes that Mikey said, I'd rather say I have anxiety than bipolar. I just want to live my life. He said, I accidentally said I had bipolar to my friends and they made fun of me because everybody uses that phrase. Well, I'm bipolar, and yeah, you're bipolar, or I'm bipolar. He goes, they just made fun of it. And so he said he doesn't want to really know people to know that he has bipolar, but rather that he has anxiety. I'm going to end my slide and stop sharing. So that's Mikey's story.
Thank you, Carol. I'm still, that was just absolutely beautiful. I'm not at all familiar with your story, and it offers a lot of hope. So Trish Ryder is next, and Trish is with the Family Involvement Center, Northern Arizona. She's the Northern Arizona Regional Director. Trish is the parent of 3 children. Her oldest son began receiving behavioral health services shortly after moving to Arizona in 1999. She has personal lived experience navigating residential treatment centers and Arizona State Hospital placements. She understands the challenges families face when their child transitions between placements in and out of the home. Trish has developed advocacy skills that she shares and models for other parents and caregivers who are currently living a similar journey. So welcome, Trish.
Thanks for having me. Let me share my story here about my son and our journey. So our journey started with my oldest son, Chauncey. That's, I also thought pictures are very important. Often making sure that we had pictures at some of our meetings, some of our doctor's appointments, anything, so people could remember that he's a human being and he has family and he's important. And so Chauncey was first diagnosed at the age of 3 with mild autism. But when he was about 8, and we had already moved to Arizona, he really started, his behavior started to change pretty dramatically. He really became more anxious. We had a lot of screaming, a lot of aggression. We could not figure out what was happening. We had a lot of challenges within school as well. So he missed a lot of school, having to be picked up. So at that point, we were encouraged to enroll him in a behavioral health home. I think that was about 1998 in Prescott. And at that time, 1998, they really didn't offer much for kids. We could get some medication, possibly. Case manager who was great came out to our home, but he wanted me to teach him about autism or, the things that were going on with Chauncey. And at some point, I eventually said, I can't do that anymore. I need someone to help me versus me being that person that's always out there telling everybody about my son and asking for help. So we were really struggling as a family. And so that was a really big challenge. I eventually got connected with some other parents in the community and started doing some community work, and connecting with other parents is what really helped me to learn how to advocate for myself and for Chauncey. And so eventually his aggression escalated pretty significantly. We went through multiple hospitalizations. I was very naive at the beginning, those first couple hospitalizations, thinking, oh, they're going to tell us what's going on. They're going to figure this out. They're going to get him stable and he's going to come back, you know, that happy kid that he used to be. Those things didn't happen. So Chauncey had at that point really changed, completely changed from being a happy young boy to being completely dysregulated. Our home environment had become very volatile. He had 2 younger siblings in the home. Looking back on it now, I think we did the best we could, but it was a struggle for his siblings and for our family, no doubt. So with the many hospitalizations, eventually we ran out of hospitals that would even take him. So this was a continued thing. We were continuing to try and figure out what else was going on. With each hospitalization, we got more diagnosis: bipolar, oppositional defiant disorder, OCD, just the schizophrenia. One speech therapist had diagnosed him and told it in his speech therapist report at school that he had schizophrenia. So we had to learn how, you know, that process of trying to get that out of his report. That was actually not one of the diagnoses that the doctors had given him. And my concern was, with every added diagnosis, led to more stigma, led to more people in school, led to more people at the doctor's office saying, this is just bipolar, this is just autism, this is just whatever. And nobody really wanting to figure out what was truly going on with him. We're very blessed. We actually saw Dr. Gregory when she was at West Yavapai Guidance Center. She was amazing. She was actually the first psychiatrist that when I would go to see her, she would hand me a flyer and say, hey, here's a training. I don't know if you heard about this, but I thought you might be interested. We'd never had anybody offer us any kind of support like that. So she was really great. She tried to work with different physicians, the psychiatrists at each hospital. And there was really no engagement with the hospitals. Didn't want to interact with his psychiatrist at the time. So oftentimes he would leave on the same medicines that he would go in there on. Eventually we ended up having to call the governor's office because my son sat in a hospital ER room for 10 days. Promised to bring him home with supports. The system said they would have supports out at our house. At that point, we brought him home, no support, no one showed up. It was the weekend, so we were on our own. And eventually over the weekend after that Monday, we had to bring him back to the hospital because we could not manage at home with our other children. With the call into the governor's office, the intent was mainly to say, there's nothing for children out here. We need help. And we got Chauncey admitted to the state hospital, Arizona State Hospital at the time, when they had a youth hospital portion, which was a completely inappropriate place, but we had no place for him. During his time there, that was very challenging. This was not the correct environment for him, but I knew he was safe. At some, you know, he couldn't really engage with the other members that were there because of his behaviors, because of the, you know, what they were going through. And during that time, we worked hard with our behavioral health home to locate other hospitalizations, trying to figure out what we could do. Eventually was placed out in Florida, out at a Devereaux facility for 8 months. And that gave us time. We ended up getting a DD group home. We interviewed providers that were willing to open a new home close to our house. We live in Paulden, so I don't know if all of you know where that is, but we're kind of out in the boonies. No one wants to come to Paulden, but this agency was willing to open a home in Chino Valley which is where Chauncey went to school. And he knew that community. So we were really excited. That first group home was amazing. They really, really were supportive of us. They helped us get through some really difficult times. The owner really supported all of us, let me sit in on trainings, help me train staff, help me look at their materials to see what they should take out and what not. I'm very big on language that we use, because seeing things that have been written in my son's reports, I think leads to people's perception that he's not going to be able to do things or amount to much. And I don't want those things in there for those new staff to be reading that. So we went through a lot more with that group home there. Chauncey trying to throw himself out the front windows. Really, really aggressive behaviors. We even got approval for 2-on-1 staff at that point. And at that point, we were really struggling with the DDD and behavioral health to come together to support him. We went through a lot of finger pointing at the highest levels of whose responsibility it was to pay for his care. And that just struggling for them to even connect with me. They had made a lot of decisions that were based on things that maybe they heard without even, calling me, who really knew him best and knew what he's been through and kind of what we were looking for support. We eventually led to find a doctor at Phoenix Children's Hospital, a GI doctor. My son was finally diagnosed with severe ulcerative colitis. So between all of these things he was having, I kept telling people something's wrong, he's in pain. And doctors were telling me, no, that's normal. That's, he's having those mood things, it's bipolar. And I thought there's something wrong. He was bleeding rectally often. They weren't just my reports, they were from the group home staff reports. He, even at the state hospital, it was documented, they still would not, the doctors prior to the one we found would not do anything about it. So most of our struggle was trying to get primary care physicians, GI doctors, and psychiatrists to work together. And that just wasn't happening at that point. So eventually when just before he was 18, we saw the GI doctor that literally saved his life. Found out, scoped him and said, wow, your son has been in so much pain. I can't believe he's been able to endure this. We've had him on a regimen of good psychiatric medications, along with all the GI medicines. And now Chauncey's doing really well. Since he's been 18, we haven't had any hospitalizations. He's been able to, he lives in a group home. He has roommates, he engages with them, he goes out in the community, he attends programs during the week, and he's really doing well. And I never thought we'd even get to that point with what we were going through. At one point, my son got down to 110 pounds, and still none of the doctors would say there was anything going on other than his mental health. So I'm pretty big on advocating for families and having families be able to share their voice and have a voice at the table. I definitely learned that working together with your team works much better than fist pounding advocacy, although there was some of that within us trying to get supports for my son. I think helping to share with providers that the level of emotional distress that parents are under, especially when they do not know what's happening with their children, they're in fear that they're going to lose them. People have to be aware of that and be respectful. Parents, I think, know their children the best, and they should always be at the table with them. We continue to have guardianship of my son. He's unable to make some decisions on his own. So we do have that. We haven't run into any problems with being, his guardian, but again, he has not had to be hospitalized since he's been on the adult side. So we've been really lucky with that, because I've heard some pretty rough struggles with parents that needed to take guardianship, and folks not working with them or not honoring that. So
thank you guys all. It's three very courageous stories, and I think it eliminates the importance of family involvement. We know that when a loved one has problems and the family is involved, they do much better. It's the profound sharing that you've done really illustrates the importance of hope, and there is hope at all different levels. And especially with stigma, I always said it's not the mental illness, it's the stigma that's so difficult to cope with. And so at this point, discussion with the participants. And so at this point, you guys can ask questions of the presenters. And so I'll turn it over to Lori.
And I want to thank.
Hi, you know what? I have a question about, okay, I'm from Minnesota and I'm just down in Arizona visiting, and I have a really close friend, and this is not children. I wish that all of this, information would have been available when I was going through this with one of my sons. But anyway, that's not the question. My question is, they live in Globe, and I'm just trying to find more resources for her. She has a son that's in his early 30s, and he is bipolar schizophrenic. And you know what? He's in the hospital right now, so she knows that he's safe and that she's kind of gotten a little breather. But they want to put him out on the street again, or out of the hospital. And his medication hasn't been regulated, but the hospitals and the facilities are so anxious to get these patients or clients out of the hospital ASAP, and it doesn't do any good, because then they either get into trouble or take 10 steps backwards. I was just wondering, in the Globe area, what kind of support is there? And as far as support groups, as far as her connecting with anybody, because she's kind of shy. She's a shy person and just needs I'm just trying to find resources for her.
So this is Trisha. I know, I don't think at Family Involvement Center that we have anybody locally there that lives there. I know one of our program managers is actually working remotely from there right now, but that's just short term. But Family Involvement Center does a lot of support groups, parent education groups that are done virtually. So that might be something that that they could connect with, just to get connected to other families.
Do you have that info?
Yeah, I'll put that in the
Excuse me.
chat to get you the right phone number.
Okay, that would be wonderful. That's art right there.
Does anybody else have any questions in the audience?
So this is Anne. I'm a family member of a 19-year-old with ASD, and it's so great to hear your stories. And I just wanted to say I've lived through pieces of all three of these stories with my son, like going to a place and you know more than they do about the diagnosis. Having him at school so quiet, and then when he comes home really just stressing out over all that took place at school, the legal system and psychosis and criminal charges. And it's encouraging in a way to hear that other people got through these things with their family members. It's really good to have you guys telling your stories. I appreciate it. So thanks.
Thank you, Ann. Obviously, we got kicked out of the internet. We're back now. Thank you, Rose, for holding it down, being connected. And George, you had your hand up. Did you want to say something?
The question had come up about accessing resources in Globe. And so now that we have our experts back online, I'd like to connect you with folks at the Office of Individual and Family Affairs of the service provider there in Globe, as well as maybe, well, I would start there, that they work very hard to help patients and family members and allies get the best services. Thank you very much.
Okay, thank you.
Thank you, George. And I think it's good to know who our OIFA leads are with our health plans in our respective counties.
Oh, okay. Well, you know what the thing is that it's just so hard to see my friend. I mean, she's got another son too that has all kinds of issues, but not exactly the same as this one. And it's just, you know what, she feels like she's all by herself. And she doesn't, I know, just recently she's had to contact the crisis team. That ended up in taking her son to the jail, and that they went down that path. But now, right now, the biggest thing that I'm concerned about for her is that she said that they are going to discharge him. And, she is his legal guardian. But the thing is that he should not be. He's a danger to himself, and he's a danger to society. I mean, he does not even know what he's doing half the time. Plus, he also uses street drugs, when he can get a hold of them. So it's so frustrating that she can't. I don't know if she just doesn't know. Well, I don't either. That's why I'm kind of asking you guys if you have any direct numbers or something that I could give to her so that and I'm going to tell her also, I told her about this Zoom meeting and she hasn't been able to get on, but did I understand that this is definitely something that she can tune into later, right?
Absolutely, she can tune into it later. I'm trying to look up the OIFA for Globe, and can you tell us what county Globe is? We're gonna just be.
Pinal County?
Now, okay, I'm gonna look it up for you.
Globe is north of Apache Junction, and Blue Cross Blue Shield Arizona did have some contract up there. Okay, so Kim, maybe Kim could step in just a little bit. Because with the Rebas, we have the OIFA office, and up here, the people, so up here, Yavapai County, Kim, for the DD folks, it's Don McReynolds, the OIFA office. That is the Reba, the new Reba, which would be, the OIFA office would be Deb Jorgensen. Could you help us with that? Because this is where it kind of gets frustrating for a lot of parents, is with a DD system or the children's system or the SMI.
You guys are giving all these acronyms. I'm going to stop them. DD, Development Disability, REBA, Regional Behavioral Health Authority, SMI, Seriously Mentally Ill. I think I got them all. Did anybody have another acronym they went? I was trying to type them. They were going too fast. Okay, go ahead. Sorry, Kim.
So I had a question too. Do we know which health plan we're talking about? There's only a choice of one? I'm guessing. I don't know.
Oh, maybe. Yeah. Yeah.
Because
that's-
there's an OIFA liaison or lead for every one of the health plans, and I believe there's 7.
Oh,
And I was also wondering if the person you're talking about also qualifies for DDD services. Do you know the Division of Developmental Disabilities?
you know what? Her other son might qualify for that. You know what I'm gonna do is can I put her in touch with one of you guys to talk to her? Or let me ask you this. So this group that right now is once a month at the end of the month on the last Monday. Are there any other Zoom meetings in between for support for parents like this, or no?
Absolutely, absolutely. NAMI Yavapai, this was going to be in the end, but we have 3 family support meetings a month via Zoom. You can go to namiyavapai.org website and click on events, and you can see every event we have. In fact, they're just on our homepage. Or you can contact us at namiyavapai.org email. Or if you want to do a private message and put your email address, or a public message, whichever you feel comfortable, in the chat, you can also do that and we will contact you.
Okay. All right.
Georgie, I put my phone number in the chat. If you want to call me or have someone else call me, I can give you numbers to the liaisons for the health plans.
Okay, and you're
Look that up.
Kim?
I am Kim Foy, and I work for the Division of Developmental Disabilities, and I am also a parent.
Oh, bless you. Okay. And I just got the 48 number. Okay, you said you know what, and I'm obviously very tech friendly. So this will be where in the chat, you said?
Can I give you the phone number? It's 480
Uh-huh.
261
Okay.
3652.
Oh, thank you.
Thank you.
Oh, this is good. This is really good. Thank you so much.
Okay, so I have a question. I'm off screen, but you can see my hand. And I'm so sorry we missed part of this. We're here at my house because I have the most stable internet, and today it did not work. But so if you covered this, I'm sorry, but I wanted to know for our panelists, what did you find most helpful? What worked best in your journey? I've been on a similar journey with you. My son saved up all of his anger for me too. And I'm just wondering, most of you have more recent journeys. And so what really was the #1 recommendation you would make for someone seeking help?
Candy, do you mean for me or for Paul?
Yes,
Oh.
I do. I do.
Okay. Well, as I mentioned, I had absolutely zero experience or any inkling of where to even start. So my thought is, okay, I'm suspecting this. I'm going to talk to a psychiatrist. But I had no idea of NAMI. I had no idea of the programs that are out there. So all of my help, I believe, came from NAMI, and meeting you, Candy and Kathy especially, just because Kathy being a peer and understanding more about mental illness. But the family to family support group or class was huge for me, to the point where I became trained and we want to do our own class now. So that's huge for me. I've been fortunate in that Paul hasn't had the level of mental illness that some of you are experiencing. I mean, his was fairly short period compared to the other two, and the fact that the first medication he was put on worked. So I've been fortunate that way, where I haven't really had to deal with the mental health system. But I'm definitely an advocate for NAMI, obviously.
Carol?
I was just thinking, some of the things that have helped me is, well, for one, I have a very supportive workplace that understands that if I have to leave to pick up my son in the middle of the day, I can do that. Being an older parent, it's hard because my husband and I were both in our mid-40s when we had Mikey. And so parents our age don't have kids this age to talk with. And so I think that's, I do need to get more involved with the support group personally for myself, for my mental self, because my husband both, he's dealt with he's taught emotionally challenged, mentally challenged children in the past, but when it comes to your own child, it's the most difficult thing ever. It's like we need the tools also to how to deal with this. And it is a challenge. And I'm not sure if any other parents can relate, but I think we both deal with the PTSD of what's going to happen, what's going to trigger him today, what's going to happen next. I feel like I'm on the edge of my seat when I get home, which I shouldn't be, because that should be your safe place. So I think more support is what's needed. I need it.
Carol, that's an interesting thing that you raised. Sometimes when I'm driving down the freeway and I'm looking at people and cars and they're going home to cook dinner and watch TV and maybe have a beer, but our people, our family members, that's not the reality. They're going home to chaos, God only knows what. And so it's a whole different situation that our families are dealing with.
Trish?
For me, I think the best thing for me was getting connected to another parent. So one of the therapists had connected me to another parent who was part of a community action team in Chino Valley. And so I got connected with her and started getting involved, so that for me was one of the best things I think that happened for us. I never thought I would have a job, which is what I have now at Family Involvement Center, because of the journey that we've had with my son. Back then I couldn't have even gotten a job, because of his needs. And so that was another struggle. But I think that parent-to-parent connection was definitely what helped me.
Okay. Do we have any questions? Georgie, you wanted to say something before we went straight to the panelists on that.
You know what? I forgot what I was going to say. Obviously, what's important.
No, it's everything's important. We don't want to,
Well, you know what? I'm an affiliate or an advocate for NAMI in Minnesota. So I've been involved with the support group I have 4 sons. 2 of my sons have mental health issues. And you know what? One of my sons just in August 11th took his own life. And he was severe bipolar schizophrenic, and he was 37, and he's been going through all of these things since he was 12. But to make a long story short, that's why when I heard these different things about the youth, I know it's still not perfect, but if I had nothing at that point, you know what? I had no idea what was going on with my son. And so the fact that all of this information and support groups and the things with the youth are finally coming to a head where people say, you know what, I'm not the only one. There's so many people that are in the same boat as me and now have the resources and the support. to me, that's so comforting. It's really comforting to know that parents have that now. So anyway, yeah, I've been involved with NAMI for like about 10 years now. So, and it's, you know what, at times it saved my own mental health because I'd be, I don't know. And I've taken family to family. I took that twice, and I'd probably take it again because there's so much in there that, anyway, I don't mean to take up all the time. I can just say for everybody that has spoken today or is involved in this, that I so appreciate you and what you're doing to, further the movement and making people aware of, that this is just like any other disease, and that people need to come to the realization of that it's not a weakness or, or you can snap out of it just like that. So anyway, enough. And I thank you all from the bottom of my heart for this information.
Our hearts go out to you on the loss of your son. And one of the things I'm hearing here is that the support that everybody's getting isn't from the system. It's from each other. It's from NAMI. And this is where, as advocates and with the Peer and Family Coalition, with the Northern Arizona Peer and Family Coalition, with NAMI Yavapai, with all the NAMI affiliates, we are becoming stronger with our voices getting louder as we come together and educate and support each other, and make a difference with the communities and with the providers. And I know one of you said something about having guardianship of your son, and he's being discharged from inpatient, but they've got to coordinate with you. And so many times guardians don't know their rights. And we've had experiences where the health home didn't understand the guardian rights, and it can take an advocate alongside with the family member sometimes to say, you can't do this without the guardian present. The member, you want the person who has the illness, the family member, to be empowered in making their own decisions. But when you have a guardian, they don't do that on their own. But the system will try to walk all over guardians in some situations. Anybody want to comment just where again the help has come from? What I'm hearing is from each other and from the NAMI groups. What has been the biggest challenge that we need to take on?
As a family member of a son who is 48, with a serious mental illness, I think believing mothers, I heard that in Carol, I heard that in Trish, that the mother went to a provider and said, Trish, you said your son's in pain. They said not. And I think that's the biggest thing, is the power of a mother. Maybe we should start having those shirts.
Well, I think it's even a step further than that, because it takes a lot of courage to go and advocate for your child, and especially courage when you don't have someone to walk that walk with you. And that's why support is so important, because you're right, your rights, and just having that support. I mean, that's what I learned. Peer support was so important to me. But one of the questions that I raised is, we all know how important the family is. We know how important support is, but why do we have such difficulty in outreaching people in our community that really want that support? I mean, how can we do that? We've got 3 support groups, and we've got a stable, group, maybe 12 people that show up. So how can we do better outreach and reach those parents and families that are so desperate? George, you've got your hand up.
Well, thank you for asking, Kathy. I think I'd like to offer a challenge politely, and that is, at a recent meeting, I saw a slide of the NAMI chapters here in Arizona. And also we met Kara, I think it was. Kara, who's in Flagstaff. And there's a university there. And how I could have best been helped is if there was help at the college level. So there are a lot of youth across the spectrum of colleges and even more relearning. So NAMI National has any number of programs targeted at youth, I think. But that would be a really good place, is to maybe reach out to the 100,000 college students here in Arizona all the time. And a way to do it without putting the burden on Kara, because that wouldn't be fair, is to say that it be done through diversity and inclusiveness offices. That whole thing of, thank you. So there's a movement. My college has a diversity office and inclusiveness, and there's another letter.
George, at one point we did have a NAMI group at ASU, and we also for youth and in other colleges. There's lots of challenges because you have to have a faculty associate attached to that group. You know, there's a lot of red tape to go through. So yes, that's possible, but that isn't something I can do again at this point up in northern. I mean, it'd be neat. It'd be really neat to partner with NAU or some of the colleges up here. But we've only got so much energy, and we're all aging out of the system.
And I have to tell you that apparently NAU does have a NAMI flag, a NAMI NAU. It's not affiliated with Arizona NAMI, which is kind of unique, but they talk about that they have a NAMI NAU. So there is that work being done. I was going to ask, I heard, Carol talked about private pay, and that is private pay insurance. That is an issue. It seems like access gets all of the, for private pay insurance.
For hospitalization or
for just in general, for services, especially for youth, that happens where the parents have insurance often.
I know that at least here in Prescott, Polera has some funding so that schools can directly refer to them to get services through them. So those are for folks that are private pay. But I agree that's been the biggest challenge for a lot of families that call us, is they're looking for real help, and they cannot get into many of the behavioral health homes or even get in to see a psychiatrist that will see a child. So that is such a big struggle.
Carol, I know the county has mental health services.
They do through the clinic, which is a separate entity of ourselves. They do have mental health services available here. I think with the mental health, it's just a challenge, not just mental health, but also health in general for children and youth. With my son's with his cardiologist, we have to go down to Phoenix Children's. So I know that's a challenge. He was seeing Dr. Cahill, he was amazing, but he stopped seeing patients under the age of 18. That's why we had to switch over. But yeah, there's a lack of resources to go to, and there's a waiting list. I mean, we waited 6 months to see Dr. Gregory.
And Will?
Yeah, I wanted to add something that just passed through the governor's office about a year ago called Jake's Law that helps with funding for at-risk youth. There needs to be an assessment by either intake or case manager. But if somebody's at risk, the state can really come through with funding.
Thank you.
Thanks, Will. And that's whenever there's a crisis, it doesn't matter what the insurance is. And I think Carol was talking about having that crisis come to your home. And that's important to remember. but up here with our rural communities, it can be hard when I hear you saying you have to drive to Phoenix for a specialist for medical. And we know that before the pandemic hit, we had a shortage show up on psychiatrists. We went to telehealth before the pandemic for psychiatrists. But when you have the private insurance, you have to go directly to them and say, who is on your panel?
I think just one other thing to add, I think for private pay families, when you're looking at inpatient needs, that's a devastating expense for families. It is just, it's really difficult for them to get through. So it's also can be a barrier for them when a child might need inpatient to actually going that route because they can't afford it. So that's just another struggle that I know a lot of people go through.
Yeah, you reminded me, Trish, when my son was 14 and hospitalized for the first time, we happened to have a situation where we had 3 insurance. We had his bio dad's insurance, his stepfather, and my insurance. That was when you could have multiple insurance coverage. And it was a half-time job for me to keep track of the insurance, which one had paid, which one hadn't paid, who goes first, who goes second, and exactly what, and so even that adds to the stress of having a loved one with a serious mental illness, in addition to, just dealing with every day, trying to put one foot in front of the other.
I think that's where the support groups come in so handy, when we can hear from each other.
Absolutely. Programs are so valuable. The people who view them on YouTube give us feedback about how valuable they are. So I really want to thank the presenters for taking their time today, and for the audience for participating and giving more information, because you just don't know what you said that may help that family member in their journey.